The content in this video is intended for general education and should not be used as a substitute for professional medical advice, diagnosis, or treatment. Mental health conditions vary widely between individuals, and any medications or therapeutic strategies discussed may not be appropriate for everyone. Always consult with a licensed physician, psychiatrist, or mental health professional regarding your personal situation. If you are experiencing a mental health emergency or are in immediate danger, please call your local emergency number or a crisis hotline right away. In the last video, we talked about why some people feel constantly overwhelmed or experience panic attacks, and how chronic overthinking can possibly raise your baseline level of anxiety. Using our water bottle analogy, some people start the day with their bottle already 70 to 90% full of anxiety because of chronic overthinking. That leaves very little capacity to handle the daily stressors of life without spilling over. So what's the goal of treatment? The idea is to lower that baseline level, to empty the bottle so you are now starting the day at something more manageable, like 30 to 50% instead. When the baseline is lower, daily stressors don't push you over your limit as quickly. Your capacity to handle stress becomes much greater. Also, when your baseline anxiety level is lower, it becomes easier to push out bothersome thoughts. The reason it was difficult to do this before was because your baseline anxiety was too high, so it was difficult for your brain to manage this. However, when the baseline anxiety comes to a more manageable level, your brain has a much easier time pushing away these bothersome thoughts. The recommended way to help possibly manage this, especially when anxiety is persistent or overwhelming, is with antidepressant medications from the SSRI family, selective serotonin reuptake inhibitors. Now, I know what some of you might be thinking. Why antidepressants? We're talking about anxiety, not depression. The interesting thing is that several antidepressants also treat anxiety disorders. SSRIs work by gradually increasing the availability of serotonin, a neurotransmitter involved in regulating mood, worry, and the brain's stress response. Over time, for many people, this helps decrease that baseline anxiety and gives them a wider buffer to handle daily stress. Basically, when the medication builds up in the system, it may help to empty out that bottle to bring down the baseline level of anxiety so that now we can possibly start the day with a lower starting baseline and we can possibly have more capacity to handle daily stressors. Common SSRIs used for anxiety include fluoxetine, Prozac, sertraline, Zoloft, escitalopram, Lexapro. Like any medication, they come with potential side effects, which is why they must be prescribed and monitored by a licensed healthcare professional. When the dose is adjusted properly and side effects are minimal, these medications can potentially make a meaningful difference for many individuals struggling with chronic anxiety or panic. Now, some people may say, I've taken these medications before and they didn't do anything. That may be the case, but there's an important detail many people aren't aware of. Sometimes a person may be on the right medication, but not the right dose. SSRIs build up a steady level in your system, and when that level matches the intensity of your anxiety, that's when the relief becomes noticeable. But if the dose is too low compared to the level of anxiety your brain is dealing with, you may not feel much difference. There is a discrepancy where the anxiety level is higher than the medication level, so it is a mismatch. That doesn't mean you should be on the highest dose possible, it simply means the medication needs to be carefully optimized. So what does it look like when the dose is right? Two signs may show up. When you begin to feel overwhelmed or panicked, you're able to redirect yourself back down to a manageable level more easily. When intrusive or bothersome thoughts pop up, you can push them away more effectively instead of getting stuck in the loop. Now, most people understandably may want to try lifestyle strategies first: meditation, exercise, deep breathing, eating healthy, improving their sleep. Many also try psychotherapy to build coping skills. And to be clear, these are all great and often essential parts of recovery. But when your baseline anxiety is extremely high, these strategies alone may not be enough. The anxiety may decrease slightly with these methods. But because of the complexity of overthinking and the high baseline to start with, the anxiety level quickly wants to move back up to its previous high level. Overthinking can be very ingrained in our thought process. It is like when gum is stuck in your hair and you are trying to pull it out, but it stays stuck in there. This is where medication in conjunction with lifestyle changes and therapy can possibly be most effective. Medication potentially lowers the baseline to a more manageable level and can possibly keep it there, which may allow all those other strategies to work more effectively because now the anxiety is more within your control. The similar challenge may appear for people who only want to take a quick-acting emergency anxiety medication during acute situations such as panic attacks. In those cases, the medication may help temporarily with reducing the anxiety, again emptying the bottle. But once it wears off, the anxiety wants to return to its original baseline and the bottle fills right back up again. And you're right back where you started. I fully believe in the value of healthy eating, exercise, good sleep, and psychotherapy. They're important, and they absolutely help. But when baseline anxiety is too high, it is difficult for them to work to their full potential. If we can first get that baseline level of anxiety down, then those lifestyle strategies will likely become more effective and likely much more within our control. If you've been feeling overwhelmed, constantly anxious, or stuck in a cycle of panic, remember, there are possible treatments that you can try to help lower your baseline anxiety and give you back your sense of control. If you found this video helpful, consider subscribing so you don't miss future discussions on anxiety, treatment options, and mental health. And as always, talk to a licensed healthcare professional if you're considering making changes to your treatment. Thanks for watching.